This is my sports injuries 15.2 presentation. So first of all, we're going to be looking at physiological responses to an injury. There are two main stages to physiological responses. These are pain and inflammation. Pain is caused by the brain sending the response mechanism to the damaged area. This is called the active primary damage response mechanism. This will then protect the area by reducing the range of movement at the area, in turn helping to prevent other parts of the body from getting injured as well. This is the pain feeling when an athlete gets hurt. This will mean that the athlete feels the pain, therefore they will stop using or putting as much strain on this section of their body. The second stage is inflammation. So inflammation is when the injury can become swollen, red or bruised. This can happen by fluid accumulating around the area which is damaged. This will therefore make the area look swollen and larger than it actually is. So as you can see in the photo on the bottom left, that's a West Ham player, James Tomkins, or was a West Ham player, he now plays for Palace. But he got headbutted, and you can see on the left it's swollen up quite a lot, and that's quite soon after the injury. So if it's swollen, this will reduce the range of movement as the area is bigger than it should be. This will also become tender to touch as pain receptors will be triggered. The redness around an injury is due to increased blood flow at the area to promote healing. So as you can see in the middle picture on the bottom, there's quite a lot of red blood. It looks quite red around his face. So this is all just to help the healing. This all therefore happens to reduce the athlete's ability to injure the area more. Therefore, pain kicks in, so the athlete won't want to use the area. So after this injury, James Tomkins got taken off because he didn't feel he could play on anymore. If an injury was due to a cut, then there is a process involving blood which will clot the area due to the reduce the loss of blood. The first stage of this process is that the platelets are stimulated due to the chemicals released when the athlete has been cut. The role of the platelets is to then increase the blood viscosity, to increase the stickiness of the blood. This therefore will then cause the platelets to clot, which creates a thick surface, or not thick, but a kind of surface over the cut. This is known as a clot and will then reduce the amount of bleeding as the blood cannot get through the clot. Moving on to intramuscular hematoma. This is where an area is damaged and there is like a bleed under the skin. In this, the only section that is damaged is where it was hit, and the blood flow does not go into other sections. Therefore, only the area which was initially damaged is inflamed. Whereas intermuscular hematoma is where the damaged area inflames due to bleeding, and then the bleeding breaks the fascia and the epimysium. This will mean the areas around the injury look as if they were injured also, when in reality it's just the bleeding which has spread, inflaming more areas. There are three stages to healing. First is inflammation, which is where the pain kicks in, the area can swell up and become red, or if it's a cut, then the blood clotting process begins. Second stage is the repair stage. This will start after a few hours of the injury and can last for as long as 6 weeks. If the athlete starts exercising before the repair is done, then the injury could reoccur or worsen in some examples. This stage is where the damaged areas and structure is rebuilt. The last stage is where scar tissue tries to replicate how the area looked before, so it will try and reduce the scars basically. This will then help to make the damaged sections look the same as they were, as they kind of used to look. However, if care is not taken when this stage is happening, then the scar can become worse and will not repair. There are three different degrees of ankle injuries. These are first degree sprain, second degree sprain, and third degree sprain. First degree consists of where there is a small tear causing pain and swelling, yet the joint is still stable. Second degree sprain consists of instability, bad pain, and sometimes swelling. This is a serious amount of damage done. Third degree consists of a ruptured ligament, an unstable joint, and severe pain. Other tissue can become damaged also in the process of damaging a third degree ankle injury. Okay, so moving on to psychological responses. So being injured can cause many different psychological responses to the injury. For example, anger. Anger can be an initial reaction to an injury, as there may have been nothing the athlete could do about it and they're angry and wish they had done something different to prevent it. They may even get angry with someone who caused their injury. So, for example, Neymar was playing in the World Cup and someone jumped up for a header and kneed him in the back, which put him out of the World Cup, and I think he broke his back. I think he did, but this put him out of the rest of the competition, and Brazil were knocked out the next game, which some people say is because he wasn't able to play. So Neymar could have been angry straight away with the person that got him injured. Another example is depression. So depression can also be caused. This is due to the fact that the athlete's playing in matches and, for example, they could then miss out on a big game from the injury, such as a World Cup semi-final. Therefore, they may find themselves feeling depressed at the fact they cannot play. The athlete might also feel isolated from teammates due to the fact that the injury has meant that the athlete won't be training with them twice a week and playing matches with them, therefore missing out on all that the banter and they might feel left out of the group when they return because they might have missed out on so much. They might feel a decrease in confidence. This is another response due to the fact the athlete has been injured before, so they might not want to then go straight back into the sport. They might be a bit extra precautious when performing the sport. So this could mean not going into tackles when playing football, which then could get you dropped from your team. Motivational issues is another response. So due to the fact the athlete has gone through a lot of pain and has been sat on the sideline for months, for example, they might not just feel like they should give up, not coming back from the injury. So they might just be like, oh, I can't be bothered to come back because it's not worth it after all this pain when I could get injured again. Athletes can respond to treatment for an injury. So, for example, an athlete may feel a sort of anxiety before treatment due to the fact there may be a chance they cannot play sport again, or the treatment may cause an injury to be worse. The athlete may also feel unmotivated due to the fact they won't or they will have 6 months left until they can begin training again due to the injury. Therefore, they might not feel motivated to come back. The athlete may also need to use goal setting due to the fact they have so long out of the sport. They will need something they can achieve in the meantime to kind of cheer them up and motivate them. The athlete could also feel frustrated due to the fact they could have done something differently to prevent the injury, which will frustrate them as they won't be able to carry on, and they'll have to still be injured when they could have done something differently to prevent it. Okay, so Jack Wilshere is a young English footballer who has a very unfortunate time with injuries. He's had 21 injuries in 6 years at Arsenal, which has forced him to miss long sections of seasons, with some injuries being worse than others. Jack is a great footballer, and some people feel he could be one of England's greats. However, he is so injury prone he cannot sustain a long period of football without picking up an injury. One of Jack's injuries was a fractured ankle, which meant he was out for 5 months. Initially, the ankle would have caused Jack a lot of pain, swelling up, bruising, and going red. After the injury, Jack would have had to have surgery to help fix the injury, and then go on to do rehab, such as a lot of work in strength and conditioning, rebuilding the strength around the ankle. However, as he is so injury prone, he redid the same injury and was out for another 5 months, which pushed him to the limit. And Jack was at one point thinking of giving up, and he was suffering from depression and self-doubt as he kept being injured and couldn't get a good run in the team. At one point in the season, it's reported he felt like retiring due to the repeated injuries. However, he has pulled through and he's now playing for Bournemouth on loan, but again, there's still a chance he might get injured again. One example of an athlete who was forced to retire is Dean Ashton, who suffered from so many injuries he just couldn't carry on. And this is a big shame because he was such a great player, and it's never nice to see another sports person have to retire due to being injured. So Carl Jenkinson tore his ACL whilst playing for West Ham. Symptoms include a loud pop, swelling, lots of pain and difficulty walking, which is what will happen initially to the athlete. Surgery is then needed to help the athlete recover from the injury. And Jenkinson had to undergo this at Arsenal after he was sent back from his loan at West Ham, as they knew he couldn't play for the rest of the season. Recovery can take from 4 months onwards, and Carl Jenkinson took the rest of the season and has only just returned to playing 90 minutes for the Arsenal reserves. Some athletes may never fully return from an ACL tear, so once the surgery is complete, the athlete will be able to place pressure on the leg, but they won't be able to kind of perform the sport. Once in rehab, the athlete will work on getting mobility and stability back to the joint, therefore performing many exercises to improve balance. At the time of the injury, Carl Jenkins was very low on confidence and was not playing very well. This meant he was trying his hardest to get the fans back on his side, as they were disappointed in his poor performances. Therefore, Carl Jenkinson went in to make a slide tackle, giving away a penalty and in turn tearing his ACL. This is a disappointing way to end his loan at West Ham, and he felt very disappointed and frustrated that it ended like this. However, he has recovered, and one day he may redeem himself at West Ham, who knows. Carl Jenkinson would have felt very unmotivated and depressed while going through the injury, as the recovery time is so long, and they can't really be certain whether the athlete will fully recover from this injury, as it's such a bad injury.